Welcome to this new module. It will cover pharmacology and drug administration. After completing this module, you should be able to recognize the various classifications of drugs and drug nomenclature, describe the actions, indications, and precautions related to various drugs, describe the rights of and method of drug administration, describe documentation procedures related to drug administration, and finally, discuss the advantages and disadvantages of various contrast media, including minor and major reactions. We can divide this module primarily into two main parts. Part 1 of this module will cover the following topics. What is pharmacology? What is a drug? The side effects, reaction drug nomenclature, dosage form, actions, indications, and precautions of various drugs, drug resources, sedation, and documentation of drugs. Part 2 of this module will cover the following topics: contrast media, modality contrast, contrast precaution, medication, and finally, parenteral administration. Pharmacology is defined as the study of all aspects of drugs, including the origin, nature, effect, and properties of drugs. Technologists should be familiar with frequently used drugs in their departments. Know the names of the drugs, the goal of drug therapies, the dosages, contraindications, and proper administration methods. Be aware of expected and unusual effects produced by certain drugs. Be prepared to assist physicians with treatment of any unexpected reactions. Any medication can produce side effects or reactions in certain patients. The technologist should notice any signs or symptoms of allergic reactions or side effects and immediately report these to the physician. The American College of Radiology, or ACR, allows the injection of contrast media by licensed and certified technologists under the supervision of a radiologist, provided it is within the law of the state in which the technologist practices. Most states, with some exceptions, allow technologists to perform venipuncture to administer contrast material. In the event that there is a written policy in place at the institution and documents certifying technologists' continuing education. Technologists are not allowed to administer any other drugs to a patient except contrast media under the supervision of a radiologist or a physician. Even when IV contrast administration is not one of the technologist's responsibilities, IV maintenance is something all technologists must handle on a daily basis. In the event of a code, it is important for technologists to be aware of the actions, reactions, and possible interactions of certain drugs, including pre-medication that is used for various invasive procedures. A drug is a chemical substance that produces a biological response in a living system. More specifically, it is used to aid in the diagnosis, treatment, or prevention of disease. Drugs may be used to cure disease or to restore a disturbed or diseased physical state to a normal or improved state. In this section, we will define pharmacokinetics, list the factors that influence pharmacokinetics, and define antagonist, synergy, and lactic acidosis. How a drug is absorbed into the body, circulates within the body, is changed by that body, and leaves the body is termed pharmacokinetics. The factors involved in pharmacokinetics are absorption, which is the movement of drug from its site of administration into the blood. Distribution, which is the movement of the drug from the blood to various tissues and organs of the body. Metabolism, which is the chemical alteration of drugs. The liver is the main organ involved in drug metabolism. It changes fat-soluble drugs to a water-soluble form for elimination. And finally, excretion. It's the movement of drugs out of the body. The kidney is the main organ of drug excretion. Factors that can influence pharmacokinetics are the age. Drugs will be metabolized differently in a child versus an adult. Even the age of the adult will be a factor, such as elderly versus young adult. Since drugs are eliminated by the kidney, hence diseases affecting the kidney or the liver will affect drug elimination. Other drugs in the body can interact with any new drug and cause an unintended reaction. Sex, male versus female, can affect how the drug is metabolized. Genetic factors, including hereditary conditions or susceptibility, will affect pharmacokinetics. Weight can also have an impact on how fast a body absorbs and metabolizes the drug. And finally, the route and the time of administration are important, and they will affect absorption and metabolization. An agonist is a drug that readily combines with the organ receptor to enhance the body's natural response to stimulation. For example, how epinephrine works in the body. When given for bronchospasm, it enhances the natural bronchodilation capabilities of the body. Synergy is described as when two drugs act together and their combined effect is greater than their individual effect. The final effect is more than each drug acting separately. For example, alcohol versus Valium or diazepam. Either drug on its own may not make a person comatose at small doses, but taken together, the patient may suffer severe central nervous system depression with a comatose state. Lactic acidosis is the buildup of lactic acid in the body. Each of the trillions of cells in our body uses energy by processing glucose and fats. The processing occurs in the power plant of our cells, the mitochondria. The mitochondria in healthy cells produces the energy we use every second of every day. During the production of energy, a byproduct called lactic acid is produced. The lactic acid is processed by the cell and eliminated from the body. But in instances where the mitochondria have been damaged, lactic acid builds up in our cells and in our bloodstream, resulting in lactic acidosis.
Thanks for watching. To purchase the full course and earn your CE credits, click on the link in the description or head on over to our website at www.medical-professionals.com. And while you're there, check out our All Access Pass, where you can get unlimited CE credits for your state and ARRT renewal for just $49.99. We also offer a host of free resources to make it easier than ever for radiologic technologists like you to achieve excellence. Check out our free Radiology CE webinars, clinical reference guides, and free CE courses on our website today. Be more than just certified. Choose medical professionals.